I'm Dr. Michael Goebel, and I'd like to talk to you today about kyphoplasty. And kyphoplasty is a procedure used for the treatment of vertebral compression fractures. And it's used for pain relief as well as to try to restore the vertebral height of the vertebral body that is sustained during a compression fracture. Now, most compression fractures are caused by osteoporosis. Some are also caused by metastatic disease, such as some lytic type processes that may destroy the bone. It's often common in individuals with osteoporosis that multiple levels of the vertebrae will be weakened due to the osteoporotic nature of the bone. These radiographs will show where the bone filler has been inserted into the compression fracture in each of these three levels, and as well a reduction of the normal configuration of the vertebral height has been achieved. We'll actually bring this patient into the operating room. It's typically an outpatient type procedure, and we will place the patient prone or on their stomach on the operating table and either use general anesthesia or heavy sedative type agent to relax the patient, to not have them move during the procedure. Here is a model that shows the actual procedure that we perform in the operating room. If this is a vertebral body that has had its superior end plate removed, or the superior aspect of the bone removed, we actually will place a needle into the bone on either side under radiographs in the operating room. And through that cannula, we will place an inflatable bone tamp, which is essentially a balloon that goes down through this cannula into the vertebral body. And then that balloon is inflated with the solution that we can visualize under X-ray. And you can see as I twist this device, it actually leads to inflation of the balloon and a reduction of the vertebral fracture. Once the fracture is reduced, the balloon is deflated, and then the inflatable bone tamp is removed, and a bone filler device such as bone cement or other type of bone agent is placed through a cannula into the vertebral body and is filled within the cavity that has been created by the balloon device. In this case, this patient presented with severe mid-back pain. Plain radiographs were obtained in our office that showed evidence of compression of the vertebrae. Here's the same vertebrae now post-procedure, which is now triangular square, as would be for a normal vertebrae, in comparison to the initial radiograph where we see a very triangulated nature of the vertebrae. So in this procedure we have reduced the fracture to a more anatomic, normal position. This procedure is designed for a pain relief type process. Patients can expect a fairly immediate reduction in their pain. They won't be completely pain-free, but they should be substantially better immediately following the procedure. The bone filler type device that we use typically sets up within about 15 minutes. So when patients are returned to the recovery room following the procedure, usually they note the pain relief right away. Typically this is done as an outpatient procedure through the hospital or surgery center. Following a kyphoplasty, patients typically return to the normal activities within about 2 weeks. And then the other thing to think about is, even though the bone filler device fixes the vertebrae in that reduced position, the vertebrae still has to go through a healing process where bone heals around that bone filler device. And in general, that takes around 3 months to occur. So we tell patients that the full time to healing is around 3 months.